Good afternoon. The purpose of my talk today is to talk about the lessons that we learned when we're doing diagnostic testing at the CSIR. Infectious diseases have been a constant companion of humankind as humans spread all over the world. And even in this modern era, these outbreaks have remained constant. One of the history's deadliest pandemic was the bubonic plague, which occurred around 1347 to 1351. And in this pandemic, almost 200 million people died. And another one is the Spanish flu, where almost 50 million people died. The recent one is the HIV/AIDS pandemic, which took place in 1981 to present, and approximately 35 million people have lost their lives. And recently, and even now, we are experiencing another epidemic, which is known as the COVID-19 pandemic. And we are currently in the middle of that pandemic. The first cluster of this coronavirus was reported in China in December 2019. This was reported in Wuhan, where they reported pneumonia cases of unknown origin. This attracted global attention. And later, the causal agent for this pneumonia was found to be a coronavirus. And it was a novel virus, which later was named severe acute respiratory syndrome coronavirus, which is the causative agent for COVID-19 disease. Over a few weeks in January, the virus quickly spread to 18 countries. By January 2020, the WHO declared the outbreak to be a public health emergency of international concern. By March 2020, the WHO declared it a pandemic as it had spread to almost 113 countries. As of the 11th of November 2020, 52 million people have died of this COVID-19 disease. And 52 million cases have been reported of COVID worldwide, and about 1.2 million people have died. If we look at the global map, we can see that the cases notification rates per 100 people indicate that the countries that are affected mostly by this virus are countries like the countries in the North America, in South America, in Europe, and in Asia. And also in Africa, there are countries that have been affected by this pandemic. The South African epidemic started in March 2020, where the first case of the coronavirus was reported in KZN. By the 27th of November of March 2020, about 1,000 cases were reported. There were about 1,000 cases in South Africa, and then the country went on a national lockdown. Around 24th of July, South Africa reported about 13,944 new cases of infection in a day, which was at the peak of the pandemic. On September, the cases per day started dropping, reaching the average of about 2,420 new cases in a day. So far, South Africa has conducted about 5 million cases, 5 million tests, and the cases of active coronavirus in South Africa is about 35,925 as reported yesterday. And yesterday, the country had reported 2,140 new infections. And to date, the virus in South Africa has killed about 20,000 people. At the beginning of this pandemic, CSIR offered to help the state with the backlog that NHLS had. Very quickly, CSIR realized that they can offer support to other industries and entities who needed testing in order for them to continue offering services during the lockdown. Then what CSIR did was to expand their testing capabilities and capacity by seeking funding for purchase of equipment, hiring qualified technologies, and repurposing the existing BSL-3 laboratory for COVID-19 testing. The testing facility at CSIR, we offer upstream services and downstream services. As upstream services, we go to those entities that require us to collect samples, and then we collect the samples. And downstream services, the samples then are transported to CSIR, where we do RNA extraction and then do the PCR testing. So far, as of so far at CSIR, we've tested 16,823 tests have been conducted. We supported industries such as Eskom, Goldfield, and we also supported NHLS, as I indicated that NHLS had a huge backlog of testing, and we were there to support them. And if you look at this graph over here, this pie graph, it shows that the largest number of people that we tested came from Goldfield, followed by NHLS, and then 26% came from Eskom. And the other entities that we also assisted were entities like DSI, Anglo-American, and Sasol. Here, this pie graph indicates that a large number of samples that we tested came from Gauteng, but we were also able to support testing in Western Cape, where we did 23% of the number of samples that we tested, and also we tested in Phumelele. The CSIR response followed the trend of the pandemic in the country. That is, as the number of these are the number of people tested throughout the country, the number of cases that were detected, and this shows the CSIR facility testing. This shows that as the number of tests increased in the country, the CSIR also responded. A large number of tests were conducted per day, which was which showed the same peak as the peak that was shown by the number of cases that were identified. The number tested by CSIR declined from September, which corresponded with the national statistics. And the people that we tested at CSIR, we tested people that were generally asymptomatic, which were mostly people from the industry. But the samples that we received from NHLS were samples of that came from the hospitals and the clinics around Gauteng. Since the COVID virus is one of the causes the disease that needs to be notifiable, so we needed to report our results to NICD, and we partnered with the ICT guys to develop a patient sample information system. This was an in-house system that we developed in response to the COVID testing, and this system allows us to report results to NICD. It's linked to both NICD and NHLS, and from this system we can also report the results to the participant, the people that we test. We only report the negative results, and we can also utilize this system to generate reports that we then submit to doctors to submit to their patients. The lessons that we learned from this exercise is that During the onset of the COVID pandemic, many countries were affected by this pandemic, and as a result, there was a huge competition of reagents. We were competing for reagents, competing for consumables, competing for equipment, and that placed African countries at a disadvantage, because most of these are manufactured overseas, and European countries and the first world countries, they felt that they should prioritize their own. Therefore, what we learned there is that African countries, and us in particular South Africa, we should promote research on infectious disease diagnostic, where we develop our own diagnostic kits and not rely on the first world countries to manufacture those for us. CSIR learned that in the case of a pandemic, it is important to quickly build a testing capacity and capabilities by doing the following. We quickly provided and obtained funding, and we quickly promptly acquired equipment, consumables, and reagents that we needed to support the testing. And we were also able to evolve the existing environment to meet the current needs. And also we learned that it is important to speedily employ personnel to conduct testing and to do specimen collection. And due to the international shortage of consumables, CSIR had to be creative. We had to sort of in-house design our own sample collection kits. Another lesson that we learned is that the space that CSIR finds itself in is a space that is regulated, and there are legislations and regulations that we needed to comply to. In order for us to comply to these regulations, we quickly had to acquire services of a medical pathologist and also acquire services of a medical technologist. Also, we needed to be able to produce results that are compatible with results that other laboratories produce. Therefore, we had to be involved in external quality assessment programs. Also, since Diagnostic deals with medical samples, we needed to be SANAS accredited. Therefore, we embarked on making sure that we work on our SANAS accreditation status so that we get accredited as a medical laboratory. Another lesson that we learned was that COVID-19 as a novel virus, it required technology to be developed very quickly. And CSIR learned quickly that we cannot only depend on technology, but we have to apply our scientific knowledge when we analyze results in order for us to get the best results, because some of these technologies had flaws in them. In conclusion, rapid response resulted in effective strategies being put in place to contain the virus. That resulted in low numbers of cases recorded in the country. Case detection and isolation allowed industries to continue operating. For example, industries like telecom, they continued operating, like Eskom, they continue to operate and to be able to supply us with electricity. And lastly, emerging pandemics shows that humans are not safe and communities need to be prepared. Thank you.